Good evening. I'd like to open the St. Andrews Task Force meeting. First on the agenda this evening is reports. First up, the Community Hospital Work Group. Patty.
Hi. Let's see, we have done, we still have one more hospital visit to do, which is Mount Desert Island, which is next Monday. And then our next game plan is we've been asked a number of questions about the services that are available currently at St. Andrews and what the pricing for those services is. So we decided that a good thing for our work group to tackle would be to compile a list of all of the available services, both at St. Andrews and also in the region. I know that the Lincoln County Regional Planning Board has a list of healthcare and wellness services, et cetera. So we want to get a comprehensive list of all the different services that are available and the pricing at the different hospitals in the region for each, blood work and lab tests and so on, so that everybody in the community knows where they can go to most cost effectively get served right now. And that will also help us in our business plan to figure out we know which services we'd like to be able to offer. We want to make sure that we can offer them and that we can offer them competitively. So that's kind of the next phase of work that we plan to do. What else did we talk about this morning? Anything else?
I think that was about it.
Okay.
Okay. Bruce, I was just curious as to where we are with the Advantage.
There are two drafts that exist of the study, the plan, the final report. They're being melded together. We're hoping that the working group, the subgroup of the community hospital group, will meet to look at the draft and make sure it's a good thing to go, and we will be presenting it to the task force, I hope, within a couple of weeks. We didn't hold them to the January 1st deadline because that was the crunch time deadline when we were going to be closing in April. Now that we got the extension, we thought a couple of weeks would be okay to get a quality product, and we think we're going to get a quality product out of it with the kind of information that we need. So we expect to be back, my estimate is a couple of weeks, and we'll be back here with a document that will be public and that will represent their best thinking about how we could move forward.
It's my understanding they still have a few interviews to do.
Sorry?
They still doing interviews?
I'm not aware of that. I thought they'd completed them. I've been away for weeks, so if I'm out of the loop on that, but they may have some cleanup to do.
I think there's a couple of tangent interviews that are pretty important, but not going to affect the base data. Like I think Bill Karen is still out there. So I think there are a couple of things, but they're small compared to the large study. And I've been speaking with Ralph and Scott kind of via email a lot, and I've been pretty close to that decision. Let's not try to hit January 1st if it means an impediment to the product, and let's put the best product forward.
Absolutely.
And I threw out, speaking for the task force, that if it takes a couple more weeks and we get a much better product, then that's what we're trying to do. I also spoke probably to Patty and Bruce and Ralph, and all my conversations are starting to meld together. But I really think that the community hospital work group, who essentially gave us the work to the Advantage people, should have the opportunity to have some dialogue with Ralph and Scott before we talk about this study publicly, saying, here it is, and here's every aspect of it. Because, a lot to the study is talking about how that works into your strategies or the other work that you're doing locally. And the only people that are really very close to that information is the hospital work group. So I was trying to put together a conference call with Ralph and Scott today, but we ran out of time. We're going to speak tomorrow via conference call, and I think that's probably the next step, and that's why I put it under old business, is now that the timeline is coming close, it's becoming more clear, and we need to talk about the expectations of the task force. If you guys are okay with the fact that, okay, maybe not the very beginning of the month, couple more weeks, but that's gonna allow our work groups to get more involved.
I'm all for it.
I would say a couple more weeks, but I wouldn't plan on past the end of the month.
No, we wanna move this thing forward. Yeah.
Yeah, and you know, like the Navigant report, which is based on tons of data and then kind of funneled into information and recommendations, this is the same, they have all their data. They're just trying to kind of finish the document and put it into a,
I couldn't agree with you more, though. Another week or two to formalize it and form up something that's better is time well spent.
I would agree that it's completely appropriate to come out of the community hospital group as well, and I think it makes perfect sense before presenting it to the task force that it be fine-tuned before it comes to us.
and you know, I haven't seen any of the drafts that Scott and Ralph, they're working kind of in parallel and they're gonna bring them together. So I haven't seen any of the information. Some of the information we might wanna have some strategic meetings, with Lincoln County Healthcare, with the work group. And until we talk to Ralph and
Right.
Scott, we really don't know.
Yeah.
So, that's kind of looming.
Chuck, if I may, on one other strand of the work
Sure.
that's going on with the community hospital group, and that's the legislative stuff. I have the legislation in to look at what it would mean to create a community hospital district here that would essentially create an administrative district that would be run, would create a hospital district run by and for the people, rather than a private, as we've seen, a private for-profit organization that currently runs St. Andrews. So it will present an alternative view of how a hospital might be run. When I get a draft back from the people, the legal beagles that are working on drafting it, I'll bring it here, and we can all have a look at it, and we can say, yeah, this is like what we'd like to go forward with, and then we'll decide whether we really do want to go forward with it, because if we go forward with it, we're going to need some support at the legislature, in the committee, with hearings, people going up there and saying, we want this. It will result in a bill that would call for a referendum in our community, so it wouldn't be a be-all and end-all bill. It would say, do we, the people here, want this or not? It would give us that opportunity. So that's still in the works, I just didn't want you to forget that.
Okay.
Thank you.
Thank you, Bruce. All right. Next up, data analysis report. Mike, anything new?
This week.
Okay.
I put together the agenda not knowing how much substance we'd have to every report, so just kind of a skeleton.
Volunteer coordinator, Peggy.
Happy New Year.
Happy
Everybody in this room and other people in this box were among the first responders when this disaster hit our community. And I think those first responders ought to be recognized. So I've given everybody an early Valentine. It's an invitation to a party in the hospital lobby on St. Andrew's Feast Day 2013. And you all know that St. Andrew's Feast Day is November the 30th. If you have an ornament, just bring that ornament, because we're going to redecorate the tree that was standing in the corner all during the holidays that the nurses decorated that came from the Festival of Trees. So all of those ornaments, nurses, are distributed in the community. Everybody has one. They're all at different homes. And we're going to be in our lobby next November, and we're going to redecorate the tree. I got the tree, so I'll show up, and I want all of you to make sure that you have the tree. So, Happy New Year and Happy St. Andrew's Day 2012.
Will you have keys to the hospital?
We won't need keys, Dan. The doors will be open, right, Patty? We have been invited by the Land Trust for a walk this coming Saturday. The walk begins really at St. Andrews Village, where the buses from St. Andrews Village will be taking us to the hospital. And then Rupert Neely will be guiding us through old foot trails back to St. Andrews Village, where there will be refreshments. But as we are dropped off at the hospital, whatever staff is there, we will get a chance to say thank you to all of them. And so I was going to encourage all of you to come if you can. I think the time is between 12:30 and 1 to show up at the village, where the buses will then, you can park your car and the buses will take us to the hospital. Dress warm because it's very cold out there. If you have any questions, you can call the Land Trust and I'm sure they will give you more details.
Peggy, this coming Saturday, according to the weather report I saw before I came down, could be in the high 30s, low 40s.
There you go, we're having a heat wave.
January thaw.
You say Peggy? Peggy?
Yes,
If I could just endorse Rupert Neely's walks, I don't know if you've ever been on one. Rupert Neely takes you through people's backyards, through footpaths. This guy came out of his house because we were going around his garage. He leads absolutely the most interesting walks I've ever been on. We've all been on the Land Trust walks, and they're all very nice. He takes you where you wouldn't think of going, and I look forward to Rupert's walk. He knows every rock and tree on this peninsula, and I really suggest that if you're up for the walk, to do it.
and wear your hearts, wear red. I don't know if we'll be walking through any places where we can nail up trees or anything with, say, St. Andrew's signs, but we might get a no-no or something for doing that. Just wear your smile in your heart and just come and join us. I mailed Freddie Luke and Dr. Stone and Andrew Twaddle their ornaments, and I wrote to them and said, these are samples of unbridled optimism. Dr. Oliphant said when I handed hers to her, "Do you know something we don't know?" No, not a daggone thing, anything different, except that the whole spirit of the community is moving in the right direction. And if, in fact, if you pick up the paper and read the Booth Bay Register online, even Joe Gilardin is making one of his New Year's resolutions is to fix this St. Andrews thing. And he is calling for, I think, you can read it for yourself, but I think he's calling for it to stay open, or let's look at this again. There's got to be a way to fix it. So I call that unbridled optimism too. All right, if you all have your weekly update, there are certain things on page 2 requested specifically from and to the task force. I'm hoping before we leave tonight that these things will be answered. The definitions of terms, people are wondering, what is it that we're supposed to expect from a strategic plan? They want to know if the lawyers and the consulting people are working together. And Helen's not here tonight. Helen, I know you're going to be watching this tomorrow. The Booth Bay Register wants their Booth Bay Region Ambulance Service folder back. And everybody wants a real financial report. They want to know what monies we have spent, or what monies are committed, and what monies we still have, and how much we need to make. If you got this in your email, you saw that we did not raise our $20,000 that we needed for the $35,000 for the Second Opinion Fund. But as of today, we still leave about $14,500. We're up to $20,660.27. We were thinking about closing down the Second Opinion Fund totally, but Alice Grant and Mary Connolly think that it needs to stay open. They're taking it over as of the first of the year, and we'll be watching it. They think that maybe in the next phase of what's happening, that we will leave this kind of account separate from the town, and at least it will already be there. We won't have to reopen it. So we're still going for the additional, we want this account to reach $35,000 to show that the community indeed wants to pay for the Vantage report, although we know we can pay anyway. So it's very confusing, but we need $35,000 in this account. Then we turn to the next page. And this is unanswered questions and new and continuing special projects this week in the past. Sadly, I must tell you that my nights are being taken away, and so I won't be able to be joining you a lot of these task force nights, but we have wonderful volunteers who are going to take over for reports and to tell you about what they've been doing, because I've kind of been speaking for them, and they're going to pick up on their own and do their own reports. While everybody has been vacationing, or at least holidaying. A lot of volunteers have been very active in trying to put together special mailings for the summer people. Relieved that we don't have to do it by April the 1st, and that the summer people may be back. What started out as a fundraising effort now is also an awareness raising effort, and people seem to want to do these mailings under their own signature. Margaret Pear gave us a great base letter from which to work. It was distributed to various people who are interested in contacting lists that they have access to. They've reworked the letters. I don't think any of the contacts have been made. They're all reworking their lists, but I'm sure they will come and report to you about how that's going in the end. Valerie wrote to me and said, has anybody stepped forward and want to lead the fundraising effort of this entire thing? And my answer is, what's my answer? I don't know.
Yes, yes.
Oh, good, okay. Pam's going to take up the fundraising effort, so very soon you'll be doing all of your reporting to her when it comes to, thank you.
Oh, please don't put that on.
All right, so there we go. We've updated hard copy distribution of the weekly updates. I'm hoping that somebody will pick up on this too. If I'm not at these meetings, I'm not sure how much information I will be able to get. There still will be office hours on Tuesdays and Fridays, but we're changing the hours from 11 until 2. Hopefully people can come on their lunch hours instead of at the end of their workday. If that's inconvenient, let us know. Maybe we can get other arrangements made. There have been discussions about websites, and I think it's a little bit premature, but maybe it's not. Mary and Alice will tell you about that on down the pike. Jim has been in touch with another woman who wants to start one. So whether it's a standalone or whether we join what the Bouvet Register has to offer, there's a lot of other stuff going on. We've been very busy over this holiday. Dorothy Hurt has completed entering all the names from all of the petitions that were signed during November. So I guess all we need from all of you is what you'd like to do with that. She's going to deliver it on Friday. We'll just give you the raw data, and then you can sort it any way you want. I'm assuming that somebody's going to want all of the lists put together and then purged so we know exactly how many names we have that are individual. And then we'll have to go through those and make sure that they're all valid names. And gosh, I think Libby Dinsmore told me that she would be very happy to deliver these reports if I'm not here, but she's not here tonight, so I can't verify that. But Libby will be talking. And let's see, what else do I have to tell you? Do you have any update on boxes? Not today. All right. So I think that that's it. And once again, put it on your calendar, November the 30th, 2013, lobby, St. Andrew's Hospital. Happy New Year.
Thank you, John.
All right. Next under reports, Luther Region Ambulance Service Work Group. Anything new, Robbie?
Nothing in the work group, but I am going to jump on my soapbox tonight and talk about our budget, which is going to be coming out in final form. We have it internally in final form. Tomorrow night we'll be meeting with our appointed 3 members from the towns, and they will bless it for the final, and it will be public. As we spoke last meeting, it is a budget showing that the hospital is going to close. And it is a budget that shows staffing levels to keep up the same level of care that we provide now. It shows that the Booth Bay Ambulance Service is still responsible for emergency out-of-hospital care on the region. There's been some talk of us throwing some of the responsibility to the fire departments for first responders. We don't see that as an option. We think that the people that work in the area that are willing to do EMS already work for us. So there isn't a lot of there isn't a big pool of people to pull from. Booth Bay Harbor is not going to form a first responder group out of their fire department. I'm pretty sure Southport isn't, Booth Bay isn't. The budget is high. In my opinion, it's astronomical to see that it's going to get to this point to cover this peninsula. That's why it's taken so long for it to come out, because we've been agonizing over it internally. And the rough numbers are approximately a $200,000 charge to Booth Bay Harbor, a $170,000 charge to Booth Bay, and a $50,000 charge to Southport. I don't believe Southport has ever gone above $10,000. In all the years that I can remember, they've never hit the $10,000 mark in their contribution to the ambulance service. Now they're gonna be paying $50,000. And like I said, this, it's based on what I would consider a bare bones budget that can provide the level of service that's needed for ambulances to be out of the region for 40 minutes to transport. We are gonna be meeting, after the budget's finalized, we're gonna try to set up some workshops to meet with the selectmen to figure out a way that we can get reimbursed without expecting all this money up front, because I think that this is gonna change. So obviously, we're not gonna ask for a lump sum payment of $170,000 from Booth Bay, like we do now. I mean, now we get paid when taxes come in, the towns issue us a check. Obviously, we're not gonna expect that. We wanna work out a reasonable way where we can account for what's going on, and we can work with the towns to get paid as we need it, if we need it. But the other thing that is changing, and we've had some discussion in this group about the safe harbors, the non-kickback agreements that we may or may not need if Lincoln County Healthcare is going to contribute to help offset our budget. One thought is that, or one opinion that we're 90% sure of is that they can't contribute directly to us. Second thought is, and Scott can jump in if I'm going really astray, the second thought was for them to make payments to the towns to offset this. We're not comfortable that that will work either. And for us to get a legal opinion, we have to hire a legal firm to prepare the documents, and then it has to go to the federal government for a legal opinion on that. And that's gonna cost us anywhere from $3,500 to $5,000 just to get that single one answer of, yes, you can take money this way, and no, you can't. And I do think that, I don't have a strong feeling either way on that, so I would say that's a 50-50 thing, but we're confident enough in the other way that they can't give money directly to us that we're not gonna ask for that. We're not gonna go after that opinion. But I do think that as all of us here are obviously concerned about the level of care, emergency care in the community, I think that over the next 2 weeks to a month, our budget is gonna be the top of all the coffee shop discussions. So, we're here to answer questions. We'll meet with groups if we need to. Once it's approved by the towns, it'll be public. We'll be able to sit down and answer questions. We're more than happy to do that. But we need to go through it and educate the communities now. Southport's is gonna come up first, their town meeting. So that'll be the real, it'll come up there. We need to make sure.
There may be some discussion that night.
We need to educate everybody, answer questions. If there's something that we missed or some way that we can come up with to save money, we're all for it. That's really my spiel for tonight is, we've prepared for what we can do, and we're gonna put it forward. It's budget time. We have to prepare for it. We have to answer the questions. We have to plan to spend the money. And that's where we are.
And we will do everything we can to keep that hospital open so that you can continue with your other budget.
I'll take a little pressure off Robbie. I did ask the question. From the way I understand it, the safe harbor rule is to protect EMS services from having influence over their budget from the hospitals.
Right.
That's the way I understand it, although I haven't reviewed the safe harbor rules or anything. So I asked the question, is that influence in the budget if you pay the towns to offset that budget?
A couple of things. The safe harbor rule is in general to all facilities that take any Medicare money, any federal funds. So the hospital, ambulances, home health facilities. And what it is, it's to set up so that there isn't some sort of quid pro quo or reverse way that there's preferential treatment from one facility to the next. For example, if Lincoln County Healthcare gives us the entire money to cover our budget, $1 million, $2 million, $3 million, whatever the amount is. Now, does that cause us to be partial to take patients to Miles as opposed to Midcoast or someplace else? So that's one variant of the anti-kickback. Or if where we feel coerced, that if we feel that we need to get this money from them, is the expectation that we're going to refer patients to them to continue getting that money. So it's almost like an inducement and entice us to go there. So those are the two factors of the anti-kickback safe harbor. So to work around that, you have to go to the Office of the Inspector General, the OIG, and you have to ask them for some sort of opinion on this. And they will allow for different variants of the ruling. For example, there are some hospitals that participate in an ambulance system that the fire department might provide dispatch. So they've actually had to go to find out, is that a kickback in some way? And so each individual opinion is based only on the information of that particular question. So it may not apply to us. There may be another hospital system out there that's facing the exact same situation, but the ruling doesn't apply to us. It applies to only that particular system that is being questioned. So for us to find out, will this be an anti-kickback violation? If it's a direct payment to us, most likely yes. Now the workaround proposed is, what about payment to the towns? And then the towns can take that money, and if they want to use it to offset the ambulance budget, fine. If they want to build a playground with it, that's their choice, because it can't be attached to any money. So that means there's two phases. We have to first have our budget approved by the towns, and then say, oh yeah, the money that you were given to offset that, can that go towards the ambulance to pay down our subsidy request? So it's complicated things. And is that truly a workaround of safe harbor, or is this just a way of working around it? That's what the question is. And there are two opposing, just like in every case, there are two opposing points of view, and our legal counsel happens to be of the opinion that you would better be safe than sorry. And that opinion, it's a $1,500 filing fee with the feds, and then the legal time to prepare the brief to get it to the feds. It's about a $5,000 proposition.
Scott, I'm just curious, how does your situation differ from that of Lifelight? Because Lincoln County Health has already said they subsidize a portion of Lifelight.
Because they receive funds from a lot of different hospitals. So if it would change, for example, if Midcoast Hospital gave us money, if Maine General in Augusta gave us money, it changes the dynamics, because because each situation is different, and we are faced with one provider for ambulance here and one provider for hospital over at Miles. So that starts to create a referral type system.
Right.
And that's what the concern is. Would we feel like we couldn't go to any other facility except for Miles because of this money that was being proposed? Or would it cause us to go there to continue to get it?
Well, technically, you can't go to another hospital outside of Miles unless
Unless the
their
patient,
doctor sends you away, or if the patient
if the
is...
patient is stable and they request it. There are some cases where a patient does have the choice to ask us to go, but it is based on patient stability and resources available, which is one of the things that we've heard very clear in this community, that they want the choice to be able to go to another hospital if it's appropriate, which is part of the assumptions that we've made in our budget to accommodate that request. Otherwise, everyone's going to Miles, and I've heard very clearly around all the communities we serve that they do not want that limitation on them.
One question, you had mentioned that there was discussion about fire departments taking on some of the services that you already provide. Is that like a budget committee type discussion?
No, that's a rumblings around town, is how come you can't operate like ambulance service X? And they have the fire departments go ahead of them, so it's okay for them to take a little bit longer to get there. And I'm fairly confident in my statement that I think that anybody that wants to do EMS on the peninsula is already doing it. And I don't think that there's enough in any one town or another.
You're not driving people away. No, no.
The only reason why I ask is on the 14th, is it the 14th? I don't have the calendar. Somebody stole my 2013 calendar that was supposed to be on that wall. I'll give the selectmen our budget plan as I'm proposing it, and then we'll spend the next couple months going through it. And I haven't proposed any changes to fire department, so I didn't know if there were budget committees level rumblings.
No, it was mentioned, I've heard it around town, and I've heard it from, in some of the talks with Lincoln County Healthcare, is why can't you do it like this and just, make some first responder services down there that can go out and assist you? And I don't think that the community here has the people to support that. Yeah, and it's still, if we've got an ambulance at Miles, and we have 2 first responders that respond to Newegg to somebody's house, they're still at that residence for 25 to 30 minutes before we can get back. So it's, if there's a centrally located service and there's just places that are just a little bit too far and the response times are a little bit too much, like the Pemaquid Peninsula, the first responder system works well there. I think that it's, if I can guess that the first responder service in Pemaquid is fairly expensive as well. I'm not sure that they save a lot of money doing that, but it's the way that they've evolved into doing it years and years ago. And it does have its validity in areas. I'm not sure that I see it here.
Yeah, I was imagining the cost efficiencies, and I can't imagine you could do it more cost efficient. You might provide an additional service to supplement.
Most of the first responder services evolved out of necessity because it was cost effective to have the fire department first respond so that an ambulance didn't have to be in that community as in its own agency. For example, so Bristol didn't have to have its own ambulance, but they could rely on CLC to come down the peninsula because it bought them some time. What we're doing would be reverse engineering that,
Right.
and saying, well, we can be further away now because we have people that are first responding. When the whole premise is based on closing the emergency room is that pre-hospital can pick up the slack.
Right.
So now we're just taking us and pushing us further back up the peninsula because some have felt that, well, we'll just have the fire department first respond and be volunteers like it was in the 80s. But that's not how the world works right now.
No, that's contrary to everything that we've been
Exactly.
talking about.
So that just pushes us, our response time and definitive care further down the road.
All right.
Thank you, man.
Mike, then Bruce.
Rob, I've got a couple of questions. You outlined charges to the harbor and Booth Bay and so forth, and those tally up to $420,000. How much of an increase is that for this next fiscal year? And is that relying, pardon me, Peggy, for getting your optimism, that assumes that the hospital closes?
Yes.
October or November 1st, what have you. So that is the hospital closing for 2 months of that calendar year.
We're on a fiscal year budget.
So you're going from what to what? It's July.
Right, and what we've done is we've budgeted for the fiscal year, the whole year for the hospital to be closed. And then what we've done is we've done we've backed some of the revenue back into it and backed some of the staffing off. So we budgeted as if the hospital was closing July 1 when we started our year. And then what we've done is we've backed out, we've estimated what revenue we will get in that first quarter. And obviously backed out the payroll that we're not gonna have to staff at that higher level for that first quarter.
That would be a full quarter, that'd be July
Yes.
to October.
Yep. So, we've got a revenue increase in the first quarter and a payroll decrease in the first quarter, and we've accounted for that in the actual budget documents. Our full budget this year is just over $900,000. So
And what will it be for
that's,
this year?
that's it.
What was it this past year?
For,
About 698, so 700,000. But the main, what's driving the increase the most is the loss of revenue. That's what's really driving the budget increase for the subsidy part. Because of the transfer work that was originating out of St. Andrews, that's all going away.
No more transfers.
There's no more transfers. So we don't know what the experience is going to be out of Miles for transfer work. A lot of the transfers that we have been doing were to be admitted to another hospital. Well, if we take them to the emergency room at Miles, they're already at a facility that admits. So that's where the rub really is. That's where the big expense and subsidy comes from, is that loss of revenue. Now, if we do a lot of volume out of Miles discharging and transferring out, and we're working on some special projects that might put us in a good position that way, then the subsidy request could go down. And that's why Robbie was talking about maybe an incremental system to see where we are once we get some experience. But the numbers that we put together were based on what kind of experience we've had out of Miles so far. So that's gonna, who knows what it's going to be like.
It's a moving target,
It's
to
a very,
experience.
it's a hugely moving target.
The town historically pays the difference, the 3 area towns, pays the difference between the reimbursable charges that the ambulance can get through sending out their own bills, and I think you use a billing service, and what it actually costs to provide the service. With that loss of revenue, that gap gets bigger, and that's what we're discussing about purchasing. Now, still, even if the ambulance service and the town were able to come up with maybe a quarterly billing, the town would still have to go to annual town meeting with a budget number of what they expect that cost to be, get permission from the legislative body, which is the people, and then they could pay out through a quarterly billing. So the number that the ambulance service comes up with, the budget process, is very important for the annual town meeting process, because we'll most likely have one opportunity to ask that question, unless we want to have a quarterly town meeting, which I would recommend against.
Then if I could circle back, and then pardon me for stumbling over your fiscal year month. What's the difference between fiscal year 11, 12, and 12, 13? I mean, and 13?
last year we got $8,000 from Southport. It's basically, everything's gone, is quadrupled.
God bless.
I don't have those exact numbers in front of me, but I do remember that Southport was like 8,500, and now
That
it's gonna
sounds
be
about
50.
right.
Town of Booth paid approximately 35,000,
And the Harbor paid 69, I think.
so 35,000 to 170,000, with some rounding.
Well, that's kind of where I wanted to go.
Yeah, it's a big ouch.
To make that known publicly.
Yeah.
Second question, again, assuming the hospital is not with us, and we're looking for a way for Lincoln County to subsidize ultimately the cost of the ambulance, we may not call it that at the time. And we need an opinion from the feds. It's not like we're going to court or anything, we're going to a federal agency for an opinion. It takes some legal work to get that done, and it takes a $1,500 filing fee to get that done.
Yes.
If indeed Lincoln County Health is willing to assist the towns with this ambulance issue, ambulance cost issue, would they be willing to pay for this legal opinion? Or have their in-house counsel do it? They have in-house counsel, Mr. Frank and others.
Yeah, I don't,
And what would be wrong with doing that? We don't care who does it. It's from the feds we have to request it. It's not like we're getting our lawyer to give us an opinion. We're getting the feds to give us an opinion, just like it costs $3,500 to do it.
yeah, I don't know if their legal counsel can fairly step into the middle of that and represent us.
But we know what the question is. We absolutely know what the question is. I understand where you're coming from. It doesn't seem like we ought to use them, but why not use them? If indeed they're willing to reimburse the towns something to make up for the difference in cost, they're costing every citizen for the cost of this ambulance service.
Well worth examining.
It's something that we had a meeting today with Lincoln County Healthcare, and that didn't make it to the agenda, but that is something that is definitely a question to ask, so we can bear the cost of that. Yep.
Thank you.
I
Bruce?
think that reimbursement to the towns is really a Lincoln County Healthcare Public Relations move. And they ought to find out whether or not they can legally do it and use their lawyers. I agree with you. You know, you all have done your budget, you're doing your job, you're doing a good job. And if Lincoln County Health wants to figure out a way that they can unmuddy the waters, they need to check with their lawyers and see if they would be in trouble if they did it.
The one little issue, or the one moral issue that I have with that is the Booth Bay Ambulance Service, and in turn, the citizens of these three towns are the ones that are gonna reap the repercussions if we get fined by Medicare. Because what they will do is if they find that we've done something wrong, they will say we can no longer bill Medicare, which means we're out of business. Because we obviously know that 80% of our call volume is Medicare, Medicaid down here. So it's a very sticky situation, and if we were found to do something wrong, that's gonna be a much higher fiscal issue for the towns than if we spend $5,000 and make sure that it's done properly and under our control. That's my real issue with that, and I think Scott has the same issue, but I'm not sure.
No, well, in the grand scheme of things, $5,000 for them to participate in is not a lot of money. But you have to understand that their legal counsel may be of an opposing opinion that it's not necessary, that's okay to just do this as proposed. So it's a two-step process. We have to convince them that it would be in our best interest to do that. And then the second thing about this is that an OIG opinion is a very long process. It takes quite a ways to get down the road to get the response back. So would that preclude them from closing in April or October or next year? We don't know. So it definitely complicates things. So there's a lot of factors that might discourage them from, but I know that they want to do things as legal as possible. So the $5,000 is not a...
There may be a workaround
Yeah.
altogether.
Well, and remember this though, this is all predicated on October 1st coming and the hospital being no longer a hospital. So I mean, if we are successful in doing what we want to do, this point becomes moot.
Well, we need the opinion sooner.
Well, of course we
You
do,
know,
yeah, it goes without saying.
Well, my next question is this. If we're hesitant at all of having Lincoln County or Maine General's in-house counsel doing this, why not just simply say Lincoln County Health, please pay for this. We want to hire our lawyer.
Yeah.
This is a
I think
$1,500 fee. This is what it's
At
costing.
the end of the day,
We need you to pay for
this
this.
is not that big an issue. We really don't want to get bogged down on
I'm
this.
sorry.
This is something we, in the grand scheme of things, is small potatoes. It's something that if we can find a way to have them pay it at the end of the day, great. But I don't think it's something we need to
We
get.
just received our legal counsel opinion last week, so we really haven't had a chance to approach Lincoln County Healthcare with this. But it is definitely on the agenda to talk to them about this.
Thanks.
Bruce?
Yeah, I'd just like to thank Robbie and Scott for their thoughtful approach to this difficult problem. But I do have a question, and that is, what is their best estimated total annual cost for the 3-4 towns due to the decision by Lincoln County Healthcare to close St. Andrews? What is their best annualized cost, total cost,
Well, last year's
over your current operating?
Last year's subsidy request was in the mid-$80,000 range. So now this year it's in almost around $400,000. So so between the three towns, so that's the increase right there. I don't
So
have the
I'm
percentage
having a little
exact.
trouble hearing, Scott, so what's the number?
Last year,
It's in the $320,000 range, Bruce.
More than four
roughly
times.
330. Last year, we were somewhere around 80,000, 85,000, I think, for a subsidy request.
And again, gentlemen, that is just keeping things
Right.
at status quo. That's not upgrading, that's not improving.
This is, right, based on status quo.
And as we've talked about in the
costs,
past,
And it's per year, per year.
Right, per year, yeah, this is ongoing.
Right.
Yeah, and as we've said in the past,
Whoa. It isn't. But if I'm hearing you correctly, Robbie, and I appreciate the effort you guys have put into this, that $420,000 backs out a quarter.
No,
That's the whole thing? That's a whole fiscal year,
Yes.
and then you're gonna back out
I think it's
3 months out of that.
I think it's a $27,000 or $30,000 positive that goes back into the budget for the first quarter. So it went from 440 to 406.
So in 2014, fiscal year 2014, we're still looking at somewhere between $450,000 and $500,000, assuming you get the monies, the transfer monies.
Well,
Right.
the total budget request, the subsidy request is what, 400.
It's like
It's
402.
not 500 at all.
No, but I mean, the following year, after we've gotten through this transition part, if this hospital closes the year following, when you come a year from now, that's your total number. We'll still be assuming things remain relatively the same. You'll be around $450,000 to $500,000,
Depending on what.
depending on what your transfer dollars are.
Correct.
Okay. As opposed to 80,000 last year.
Right, I mean,
80
this is,
something.
this has changed the way healthcare is in this community.
Right, I understand that.
So, rather, this year, this is not a one-time shot. We hope it to be. We would hope that we would have the volume to support, so that we would never have to come back to a community and ask for a subsidy.
Right.
But that's a huge assumption. That's why hospitals are shutting down, because the patient volume isn't there to support the
So
entire
in
system.
what seems to be an area of increasing taxes, we're also going to have increasing real estate taxes.
Absolutely, it's the same thing as I said when we first met, it's the same thing as the school's funding formula. As the state has decided what is no longer in the formula to balance their statutory requirements, it's pushed down to the local community to pick up the difference. And that's what's happening here, except it's healthcare. That's what's happening in other parts of the tax bill. And it just can't help but happen that way.
But the big difference here is, and I understand your comment about the school thing, but the big difference here is a private, unelected board working in the background without any accountability really to us, has essentially closed the door, or is trying to close the door and stick us with a huge tax bill. And costing jobs and diminishing our access to health care. Other than that, what's wrong with this picture?
Tom?
I want to emphasize the multi-year aspect of this thing. Once again, a lot of people seem very confused about that. The notion of Lincoln County Healthcare, quote, picking up the tab by contributing money to the towns is not forever. It's for next year and for some period of time, over the next couple of years, maybe, I don't know.
and also, when they're talking about picking up the tab, they're not talking about picking up the whole tab. They're talking about, some amount, and
The
then
real
it
question
will
is,
decrease over the next
how
3 or
much-
4 years.
It's an adversarial negotiation that they're engaged in with the towns and the ambulance service with an object to see how little they can get away with. And one of the things they've concluded is, I think, that they must put something out there in order to shut us all up, which apparently they may succeed in doing. But at the same time, well, some people think maybe not, such as Climate.
Yeah, I'm one of them.
Anyway, the point is that the impossibility of this situation is not just the multi-year aspect of it. There's also what happens in this next year. For example, we just been through a long discussion about whether or not, who should pick up the tab for this $5,000 for this very long process that would include getting an opinion from the federal government as to whether or not the currently proposed scheme, which has not been negotiated yet, as far as I know, whereby Lincoln County Healthcare would pay to the towns this money. The real question, the increased budget for next year, that remains to be negotiated. But even if it were negotiated, my question for the towns is, what are they going to do at the annual meetings that they at the town meetings that they have scheduled over the next couple of months?
Well,
Are they going to assume that
speaking of Southport,
Yeah.
I can only say that we will have to look at the assumption that St. Andrews will become a urgent care facility on October the 1st and budget accordingly. I mean, how can we do anything else? It would not be responsible for us to do anything else. If we find out that that becomes not the case, that if we are successful in our goal, then that's found money that we can reappropriate the next year for other expenditures. But we're not going to have a choice, really. I don't see how we can do anything but fund these gentlemen.
And what happened, I'm not familiar with what happens in the event that that tax increase gets rejected by the people at the town meeting.
Oh, then we got a whole nother bag of cats.
You can't appropriate it.
Right.
And then
And
you
what
can't spend
happens
it.
if that happens at just one out of the 4 towns that all have to approve this tax increase?
You're right on par with what I was waiting, I didn't know where you were gonna go with this, that's exactly what I was gonna say. Is that we're talking about if, then, if, then, if, then.
Yeah.
Well, eventually you need to get to the point where 3 towns will have to locally decide on their own terms whether receiving any money and expending any money is appropriate to the legislative body. So that's a very localized question, and if voted down in any one of the 3 towns, it makes it a very complicated answer. And you know, that's one that I think Southport's gonna have to lead just by timelines, is that they'll have their question first. And in March, and you know, well in advance of Booth Bay, so I'm glad that they take the first stab at it.
I think I can say that at Southport in March and in Booth Bay Harbor in May, there's going to be some pretty lively debate on this question on the town meeting floor.
Oh, you can take that to the bank.
Oh, yes, on both sides. Just because the number to the taxpayer is going to be so huge.
Now, if the question to propose, you know, $170,000, which is one of those questions where I can already hear myself recommending to the selectmen, this is a question in itself, take it by itself. And then I would also probably recommend that this is a referendum style question, just to cut out. You go to town meeting with probably a couple hours worth of questions in itself. You're talking about maybe a multiple hour question here. I think that's one of those questions you gotta have a public hearing and a private debate, and then have a referendum style question where people can show up and vote appropriately, and you don't get into a lot of the neighbor versus neighbor and an open floor, because it just clouds the question. But that's for March for us to talk.
It may cloud the question, Jim, but welcome to Maine democracy at its best.
We'll be doing it right on the floor.
I just, you know, my comment comes from the fact that you wouldn't want, you know, I mean, how many people are interested in this topic? Well, the petition says thousands, right? Well, let's say 1,000 people in Booth Bay want to vote on this topic. Well, that's quite a bit more than we get at an open town meeting. So you want to afford them the opportunity to vote on it, which so a referendum article is where you would hear me recommend. I know there's pros and cons to both, but I just couldn't imagine us managing 1,000 people in a room because they showed up for question 41 or whatever it ends up being, and that impacting like the operating budget, because that's not in the best interest of the town. So, and I think all things considered when we get to that point.
This is not a process that is going to be hitting the floor at town meeting. I mean, they've already been in many meetings in their own budget committee. They're going to go to our separate budget committees, and we're all going to heavily debate it at those, and then it's going to come after a lot of thought and work and debating to the town meeting floor. So I mean,
Yeah, well,
There'll still be a lot of
It's
debate
going to be
there.
interesting.
there's still gonna, even if you had a referendum vote for extra people not to show up to your town meeting and vote on, and have an opinion about something that may or may not be
Yes.
open on the floor, it's still a possibility.
we skipped over the topic of what if it doesn't pass? What if it doesn't pass? Then what happens to the ambulance service?
They don't go to Southport.
Actually, Boothbay Harbor ran into that same issue a few years back when they reduced the appropriation. And I can't remember how the ambulance service solved it then, but they solved it.
That was, about 5 years ago when LD1 didn't pass. And, what ended up being the answer from the budget committee and the selectmen was to cut all the outside organizations. And we're classified as an outside organization. Our charter clearly states how we are funded by the towns, and for that funding, how we respond and what we respond. So, when it comes to $50,000 or $0, the question is very clear. But if, if Southport votes 45,000 and Boothbay votes 160 and Boothbay Harbor votes 180 instead of 200, if it just gets reduced by a certain amount, then what we need to do is go back to what is the level of care you want. It will, the next few months is gonna be very complicated, and then if it doesn't go through in one of the towns, it's gonna be hugely complicated. It was different when the LD1 didn't pass, because then it became a selectman's decision on where to cut the budget, not a taxpayer decision on where to cut the budget. So it was a little bit different. It was easier for the ambulance service to play hardball and say, this is the number for us to provide ambulance service. If it's the taxpayers at a town meeting that in person vote not to fund it for some reason, then that becomes a whole different ball of wax, unfortunately. But I think, like Jim said, that there's going to be a meeting with our budget committee tomorrow. Then it's going to be obviously out to the selectmen, and I'm sure because it's a high number, we're going to end up in 1, 2, 3, 4 hearings or meetings. Personally, I'd like to do hearings and meetings with the groups of selectmen together, so that I don't have to go to Boothbay and answer 50 questions and then go to the harbor and answer the same 50 questions, which is traditionally what we do. I go to Southport Budget Committee and I answer the questions they have, we review the budget, and I go to the Boothbay Harbor Budget Committee, and sometimes several meetings, and answer whatever questions they have. Then I come to Boothbay and meet with them and answer whatever questions they have. But I think this year it's going to be such a process that I'd like to try to streamline it to, 2 or 3, if they have to be public hearings so that the groups can be there that need to be there, then that's what they need to be. But I do think that, a meeting with each town individually is fine, and then a couple of group meetings if we need further. I think that that's appropriate. I don't think 3 or 4 meetings with Boothbay and 3 or 4 with Boothbay Harbor, separately. I don't think that, one is I'm not sure if there's enough time in the calendar to get all this hammered out if we don't group up and do it together. So.
I think there's really 2 real questions, and I don't have any of the answers to the rhetorical questions. First is the ambulance service put together an appropriate budget for the selectmen and the town to entertain, and then second, will the town appropriate that money for it? So, I think that'll be confusing, because you really only get to ask the one question. Sure, you can have the town meeting from the floor comments, I think the budget's appropriate, but I'm voting it down because of Lincoln County Healthcare.
Confusing too, because of appropriate and appropriate.
Appropriate and appropriate, yes, that is extremely confusing.
I suggest we move on.
I just have one more question, and hopefully it's a segue to another topic. My understanding is that some of the hospitals elsewhere in the state and elsewhere in the country actually run ambulance services. Well, I know that that's true. And I'm very uncomfortable even bringing it up because I like what we have. But has that been a topic of discussion, saying Lincoln County Health, here are the keys, you do it?
Well, the way our charter is set up, the 3 towns own the ambulance service. It's a 501(c) private corporation that all of, as far as I'm concerned, all the assets belong to the 3 towns. And there is some confusion, I think, in the room that Edgecombe does not participate in our budget. I've heard some people say 3 and some people say 4. I know the task force is 4, but we do not serve Edgecombe on a first call basis. So it's Boothbay, Harbor, and Southport. And that is some of the, that is, I guess, one of the end all things is what do these 3 towns want to see for ambulance service? Do they want to retain control of it? Which, when I say retain control of it, there's an appointed person from each town that reviews our finances and reviews our budget. And we, as far as I'm concerned, we answer to them and the selectmen. Or do we want another outside organization? If it becomes a community hospital and we have control of that, then maybe it makes sense. I'm pretty sure that nobody in the room probably wants us to give it to Lincoln County Healthcare.
They never come.
And that's been a topic. It's been mentioned in several places, and that's why I brought this up tonight. It's obvious that just in this room, the questions and the discussion, and when the general public of the 3 towns see these numbers, it's going to be everywhere.
That's good.
But to look at, let's just start from scratch. No ambulance service exists and no hospital exists. The towns are individually trying to put together an EMS service, and they have to start from somewhere. All 3 towns would be doing the same thing, trying to put together an EMS service. It would be smart of us to try to do that together, and then you probably end up with something exactly in the same light as Boothbay Region Ambulance Service.
I think my experience is we're on par with other towns' expenses.
Last question, Bruce.
Well, it's not a question, but an observation, and that is that if we're talking about an increase in costs of $500,000 roughly annually to run the ambulance service because the emergency room is closing, it raises the question in my mind of what does it cost to keep the emergency room open?
That really does boil right down to that, doesn't it?
And those costs, by the way, if it's a critical access hospital, are reimbursed by the federal government $1.01 for every cost that is incurred, which does not happen in this case. So, like we're going down a really bad road here. I mean, they have to plan this, but this is going to cost us a lot of money when a smarter decision would have been to keep the emergency room open and get the federal reimbursements. And I know that's tax money, but it's from a wide base, not just the taxpayers here in our 3 towns. So it strikes me as, this is insanity.
The property owners, not just the taxpayer, property owners.
Property tax.
Right.
So anyway, I wonder if there is actually some way to approach this question that way. And say, if we had $500,000 from the taxpayers, I don't want to pay that, but if we had that, to go to the ambulance service, could it go to the emergency room? I don't know. I mean, I don't know. I don't know how that would
Either way, it would still end up costing us $500,000, and we don't want it to cost us $500,000.
No, I know that, but I mean, but the money that's spent at the hospital is reimbursable by the Fed, so that's a real interesting point.
Now,
I just want to point out that the cost of the ambulance service is not, you know, it's a 501(c), as was mentioned. Its budget is completely outside the realm of Lincoln County Healthcare's budget. So their analysis and their, quote, saving money by by closing St. Andrews did not include that consideration.
Not
that
at any level.
$500,000 additional cost. Nor did it include the decrease in real estate values on the peninsula. So the economic impact that they studied was purely the consequence of the $1 million worth of payroll reduction that would be affected at St. Andrews Hospital, which by some interesting coincidence happens to be equal to the annual salary of the CEO of Maine Health.
yeah. Now, I got a quick, it probably won't be a quick question for Robbie and Scott, but I'm sure you guys can answer this for me. The increase in the budget is due to the transition of the ED at St. Andrews to an urgent care clinic, because you guys can't go to a clinic, correct?
Yes.
Why?
The reason, there's many reasons why we can't go to an urgent care facility. One is that I don't believe it would be a reimbursable charge. And that's not a reason we can't go there, but that's a reason why it would be an ambulance call that the taxpayers would end up paying for anyways. So it wouldn't necessarily help this dollar figure, because we would be taking somebody there, but I don't think we'd be able to bill for it.
Right.
Just like if we take somebody to a private doctor's office, it may be perfectly medically necessary for someone to go from their home to a doctor's office in an ambulance. Could be all the reasons in the world for that to be paid, but the federal government just says it will not be. So that's a cost, that's a private pay cost. Somebody needs that service and they have to pay for it.
Because I thought I had read somewhere that there are states out there where
There are states
ambulances
out
do
there.
go to clinics.
They're out there, there are states out there, I think there's actually hospitals in Maine, or clinics in Maine that allow ambulances to come. But that doesn't, all the services aren't there. So it doesn't really do us the same, it doesn't do the patient the same justice. Yes, it gets us back on the road and available for another call, but it doesn't get the patient the same coverage. And the real issue to staffing is the fact that most of our staffing at night now is based on volunteer, where people get a $3 or $4 stipend to be on call at night, to the fact that we're gonna have to have paid crews because there isn't gonna be any place at night. So it's not like we're going to decide at 10 o'clock at night that Chuck Cunningham can go to the urgent care instead of Miles or Midcoast, because it's gonna be closed. I mean, we're already staffing full-time day crews. So the staffing increases during the day are minimal. The biggest changes in staffing are at night, when the urgent care is gonna be closed completely. So whether or not we could take somebody that needed a few stitches down here, instead of taking them to Miles, my question to that would be, if they can go down here to get a couple stitches, they can probably go in the car and save us all some money. And I believe what would have to happen was the hospital would have to petition their licensing board to allow them to take ambulances. And then they would look at what the need was. It wouldn't be our decision to decide whether we can go there. It would be the hospital's licensing board at the state to say that they can accept ambulances.
Thank you, Robert.
It would not be reimbursable by Medicare.
I don't believe it would be.
Possibly not. But one of the issues that it brings up is, if we have having an urgent care facility in the community that's open for a partial part of the day, brings up an interesting situation. Now, how would you feel if your ambulance took someone that had a small laceration to the emergency room or the urgent care facility that was 3 minutes away, and then when you were having a heart attack, you get to go to the emergency room that's 20 miles away.
Well, that,
So it causes this whole, so is the best answer just to say, this needs to be off the table? Because there are times when we're probably going to be responding to the urgent care center as the caller that wants us to take their patient that walked in thinking that they just had indigestion, when in fact they're having an MI. So they're calling us on 911, just like if they were in their home, to take them to another facility. So it's a real convoluted process to say, certain parts of the day, can we just go down to urgent care?
Just gonna make things a lot simpler for us to save this hospital. This is gonna be much better for everybody.
Does anybody know if the urgent care center is supposed to be open on weekends?
I have no idea.
yes.
Yes.
Okay, I have not heard anything
Yeah.
definitive, because it seems that, you know, there is an awful lot of concentration of medical care planned for the daytimes. And if they weren't going to be open on weekends
Yeah, that was a
and
question,
holidays,
that was a question that I asked them, Dr. Oliphant, and they would be open 7 days a week. All right.
To start with.
Yes.
Legal work group.
Okay, there's not a tremendous amount to report, but we did have some conversations exchanged with Julius and I through email. I think I sent the email to the task force members. The largest thing was that he wanted to make sure that the work groups knew that it was expected from that Lincoln County Healthcare would eventually want to have some dialogue with the task force and to keep your levels of enthusiasm up, and that you know that this so the kind of the transition into some discussions that we've just started to get into was expected, and there was some cautions, and now the entirety of Julius's comments are kind of reserved for the task force. I didn't bring those to here, but then a question Peggy had brought up, is Julius working with the consultants? Not yet, because the consultants are kind of in their creation of a document stage. When that document's ready, Julius is also knows that we're gonna make that available for him. And that'll be a pretty big tool for him to use. But at some point in time, we're gonna have to bring our legal consultant, our lawyer, in line with our healthcare consultants. But that's all I have for now.
Thank you, Jim. Next on reports, financial and fundraising.
So the account breakdown that I put in your packets will show that we've gotten current December with less bills being received, more bills being paid. We're current on our outstanding bills except for the iVantage report. There's about $12,000, I think $12,500 worth of expected contracted work that will become billed to the town at some point in time. So the town to date has received $61,838.90 in the St. Andrews Fund. We've expended $54,585.89. So there's $7,253.01 remaining in the fund. That's obviously not $12,000. So at some point in time, we'll need to transfer some money from the second opinion fund, and obviously the town is not the gatekeepers in the second opinion fund, to make sure that we have the entire amount of money to pay for the iVantage report. But between the two funds, that money exists. So our obligations are accounted for in funds. Now, that doesn't mean we have a lot of funds available after we get to that point. I'm implying that the report from iVantage will be a stepping stone to another point where we may need funds. So what was the second opinion fund?
As of today, it's a little over 20.
A little over 20.
It's at 20, well, it's about $20,660.27, and Jane brought me another check tonight for $100. So we're at $20,760.27.
And I saw that we had received some letters attention to the task force. I'm assuming that they were probably donations and they may not be accounted for in this. So we're in the ballpark of $27,000 in funds that we have, and about $12,500 to $13,000 worth of obligated expenses that will come about. Does that make sense?
So we have about 14,000
About,
to play with still.
right. Not to play with, to work with.
Well, okay. Darn.
Anything that we need to touch upon on fundraising while we're on this topic?
Yeah, I guess so. She's not looking at me, so I guess it's my turn. And this isn't anything to do with fundraising, but I want to say we have they're gone. Fabulous ambulance service.
Yes, we do.
We know that firsthand, believe me. We were so lucky to have them. Anyway, fundraising. I'm not quite sure how I got to be head or what I do as head, but we have scheduled another dinner. So everybody go home, mark your calendar, February 15th. We're not sure what we're having yet. We haven't actually talked about that. But we do have the date. It's going to be up at the fire hall, Booth Bay Fire Hall, same as before. And we had such a good thing there. Now, somebody said you should bring your sweethearts. Well, you can do that, but you also should bring your spouse.
If they get along.
Huh? You gotta bring everybody, you know. So we'll get back to you maybe at the next meeting about what we kind of plan for a meal and what we're going to need everybody to do some cooking again, or, you know, cough up with money one way or the other. So that's about all. Skip, did you say you could get me Capital Islands list? I'd appreciate it. I've waited twice now. I've made a call to get it and hasn't come yet. So if you could get it, that would be great. And now, Peggy was saying that other people were working on sending out letters to different summer people. I don't know if that's something you want to filter into me.
Nobody's here that's doing that.
Nobody's here. Okay, so we won't discuss that then. If anybody wants to, feel free. And just let me know who you send to. Give me a list. Okay? All right, that's it, I guess.
The time, have you nailed the time?
No. We'll get you that next week. Okay? Lucky we got the date.
Next under reports, meeting with LCH and Maine Health.
Obviously, everybody knows that we had a meeting with Lincoln County Healthcare and Maine Health on the 21st. Tom Tavener represented the task force, so they went into a public session, went into executive session, and then invited Maine Health and Lincoln County Healthcare representatives into that meeting. I figured I'd give it to the task force members, so all 4 of our task force members are there with Tom Tavener, and you guys can report. I brought the handouts, the data handouts that they've given us, and if you guys don't feel like there's anything confidential in there, we can make those available to Peggy to have on hand. But they were really just data-driven handouts.
Well, I can tell you that it was good to sit across the table from the folks from Lincoln County and Maine Health and actually, for the first time, get a chance to assess who they are and what they're about. In particular, Mr. Kern. He is a very sharp individual. He's the head of Maine Health. They are very open to listening to us. I do not think they have any intention at this moment of doing anything different than closing the hospital as a hospital and turning it into an urgent care facility come October the 1st. I do feel that they will be open to listening to what we have put forth. But we've got a long way to go to change their minds. There's not even a question. As we sit here right now, in my opinion, from having sat and talked with these folks, that they are willing to work with us, they're willing to talk with us, and they're willing to close the emergency room and our nursing beds on October 1st.
Can you tell us who was at the table with you from Lincoln County Health and
Yeah, I don't
Maine
think
Health?
that's an issue. It
No,
was,
it's Bill Karen is the CEO of Maine Health, Jim Donovan, CEO of Lincoln County Healthcare, Pete Mundy is the chairman of the board, and Dr. Foray, who is also a member of the Lincoln County Healthcare Board. Am I missing?
that was it, that was the four of them.
And those have been the same people that we've met with in the past. And I think they will probably be the leaders that represent the county healthcare and Maine Health going forward. One thing that I could add to there is I hear a lot of people talking about, in the ambulance service, talking about Lincoln County Healthcare making an offer to pay for some of that cost attributed to the ambulance service. That was not offered at that meeting, nor has it been negotiated and ever brought to the table. I've already told Chuck my thoughts, is that at that point in time, that's an individual town selectman's kind of negotiation. And that's what I would say then. Now, if the task force entertains having that discussion, that's up to them to make. But that negotiation has not happened to this point. It hasn't even been introduced.
I can say it was nice to be able to go into executive session and have these two folks sitting at the table with yourself, Stuart, and myself. We're gonna get a lot more accomplished sitting as the five of us than just three of us.
Oh, and the other thing, I would to interrupt you, Chuck, but they're simply not gonna sit in an open forum like this and talk with us. It's just not gonna happen. As much as I would have no problem at all with us all sitting here and you guys listening in, they're just not gonna ever play that game. It's just not gonna happen.
Why do you think it's not?
Because they don't need to and they're not going to. Pure and simple.
So,
why meet with them then?
Because it seems to be they're the ones in charge of our hospital. So I think it's important that we have a conversation with them.
Yeah, but if you're not gonna change it.
I'm not saying we aren't gonna change it. I'm saying as I sit here right now, they don't have any intention of doing that. Do I think we can still change their mind? Yes, I do. When we get our report to put next to their report, and they're both on the table, and everybody can read it, and they start realizing that we can make an argument as strong as they can make an argument, there may be room for some negotiation.
It's like Smith said, they are willing to listen to us and look at the information that we have. They're just not at the point yet where they're willing to change their mind. But then again, a month ago, I don't think, I would have thought that we would have gotten a 6-month extension, and they gave us that. And that gives us a little more time to sit and talk to them.
Well, the reason I ask is, I've spent a good amount of my time this week involved with the services provided by Lincoln County Health. And the impression that I get is that it's already over. It's a done deal,
Well, that was their impression when we spoke to them July 31st, that it was a done deal.
and it hasn't changed.
Well, I'd say, yeah, it's changed a lot. We got another 6 months out of those people. So that's a big change. And I also think that the people that are on that board, the Lincoln County Healthcare, especially the ones that represent, in theory, represent St. Andrews Hospital, are starting to feel a little bit of the pinch. And if we can, with our report and our abilities to sit and talk with them, we can get them to take another vote on whether or not this place ought to close down on October, we may be able to get a different vote. And then that would certainly put an interesting spin on things from Maine Health. And I don't know if that will happen. I don't know if we can make that happen, but that's what we're going to try to make happen.
I'm sorry, there's another thing that could happen, which is that the legal report could be turned over to the Attorney General of the state of Maine on the grounds that these people have betrayed the interest that is reflected in the basis for the original formation of the charitable corporation, which is St. Andrews Hospital. And we want it back.
Yep.
That seems to me is the ideal result that we're looking for.
It's probably an appropriate time to say that the task force recognized the AG's role in this a long time ago and had some conversations. What wasn't appropriate a few months ago was to put undue pressure on the AG. But the AG has had our position paper, they had it first. And they had it before the public had the position paper. It's now an appropriate time to ask the AG, will you act? And the AG is an officer and official of the state of Maine, so we'll have those discussions, and you guys have every right to have those questions for the AG, our state representatives, anybody that will listen right now.
Have you gotten notice about Donovan coming up? Yes.
But that's all I can tell you about our meeting with Lincoln County Healthcare. I thought it was productive. I thought it was certainly worthwhile, and I think there's some hope we can get some movement there.
And we're meeting with them again next week?
We're meeting with them again.
And I would add that it was a very candid conversation. I think that we were very honest in how we felt, and we were honest in the questions that we asked, and I thought that the questions went to the heart of the issues, that what we wanted to keep it at St. Andrew's Hospital, what the services were that we wanted to keep there, and why we felt that way, and they did listen to us. Another thing I would add is that I think that Lincoln County Healthcare and Maine Health are going to be coming out publicly soon, and that you can all expect that, or you all should expect that they'll be coming out with their responses to what the task force has been putting together with the position paper, and they're looking forward almost as much as we are to the iVantage report coming out, so that they can formulate their responses to that. And they've said that they'll be answering questions publicly sometime in the near future, and doing public sessions with them talking about why they want to close the hospital and why they're doing what they're doing.
It's a really good point, is that both sides can agree on one thing, is that we both can't wait for the iVantage report to come out.
Dan?
I have no question about your honesty. I have a lot of questions about this.
We've told them, Dan, they've got a long road to go before they win back any of the trust of the public.
What's the response?
And they're gonna play that game up until September 29th.
Just
Just
their
like
response,
Congress.
to Jane, their response is they recognize that they have handled this poorly.
Oh, they did a terrible PR job.
Well, and they know that, and I do think that they're,
But that's not
Is that
the
what
point.
they call it?
That's not the
when you're all done chatting, I'll try to carry on. They know that they handled this poorly. I think they're getting a little tired of hearing about it, and I kind of told you, well, you're gonna hear about it a lot more, not a lot less. But, they made this, we all know, this is a business decision for them. At the end of the day, I mean, and again, because I know they'll be watching, in my opinion, this is couched in medical terms, but it's really about dollars and cents. And so we've got to, but I also think that if we can show them that this can be a viable in the black entity, that they're looking for viable in the black entities. So that, to me, is a strong point for us. If we can show that this hospital is viable, and then we can actually make it more viable, it's going to be hard for them to continue to make that decision.
Well, and just enable them to figure out how to make it run in the red.
Well, if that's their goal, I suppose.
That's their goal, so that there's no reason to keep it open.
Right.
If we can make it run in the black and they can make it run in the red,
I think the board of or the trustees, I guess in this case, I think, and I'm just saying this based on a whim, are looking for an opening to have new information to analyze. And the iVantage may be the opportunity to say, okay, here's some more fact and data, and to have the trustees give them the opportunity that they might recognize a different set of data, and then to recognize that this is a legitimate reaction to the service changes that they put forward. So I really think that the community needs to be open to the fact that the Board of Trustees, who are people that belong in our community, might want that opportunity to change their mind.
I'd like to point out that we keep referring to the Board of Trustees as the Board of Trustees as though they had authority. The Board of Trustees of St. Andrews Hospital is appointed by the sole corporate member of St. Andrews Hospital, which is Lincoln County Healthcare.
Main Health.
No, Lincoln County Healthcare. The Lincoln County Healthcare itself is a charitable corporation with a single corporate member, Maine Health.
We know.
The Board of Trustees of Lincoln County, Miles, and St. Andrews should better be called a Board of Advisors because they have no authority. They can be replaced in an instant by the whim of, I shouldn't call it a whim, by the decision at Maine Health. That's the way it works. That's the consequence of the governance that is currently established. And it's that governance, in my opinion, which is the fundamental problem that we're confronting. And the issue is not that they did a bad PR job in announcing and going through the process of deciding to close St. Andrews. The issue is that they did it without referring or getting the opinions of any of the people affected who all thought that this was a, quote, community hospital, and it's not. It is not, and it will not be unless the governance changes.
No, I agree, Tom, that, you know, but let's just to play with the hypothetical that the Lincoln County Healthcare Trustees entertain changing their mind. And let's say they even had a vote and the majority said, we change our opinion. That's a situation I would like our community to be in, where our local board has said, we change our mind. Now it's up for Maine Health to say, are they going to back the local board's decision? Well, that's an enviable position for us right now. We want to be there. And let's say we even get to the point where all of the local people that are on that board change their mind, and the 7 doctors and the people that are in Miles don't. Well, that's kind of an enviable position too. The people that represent our interests see our point of view. Let's try to get to that point, and then let's try to knock down those doors. But we have multiple things in our way, and right now, just to have a good
Let's
position.
convince Simon Legree to go a little bit easier on the rations, but not change the slavery that we're living in, is what you're saying.
I love your point of view, yes.
Mike?
Perhaps if we can sum up, I've had conversations with more than one current board member. I didn't mean to represent the board at all, but I've been involved enough to say that I believe if we ended up with our community, the benefactors of the 501c3, ended up with an ER that's open, with hospital beds, a number of which may be negotiable, and a transparent governance of that facility, this committee would fold up its tent and go home. We could help create what exists thereafter, but we'd go away. That notwithstanding, there's very little case law on some of the legal issues, as you mentioned. And this committee, if it doesn't fold up its tent, is willing to make new case law if need be. We're here for the long run.
Yep.
And though that is our position. Meantime, you folks we're all talking through our hats until we get the Advantage report, but it's good that we're all sitting in one room and can talk in these terms. But essentially, that's what we're after. The hospital open, transparent governance. Too little, we're gone.
Right.
We're absolutely gone. It's almost that easy. The board members, I believe, if they think of it that, the ones I've spoken to, if they think of it that way, they say, that's a pill they can swallow. It absolutely is. So again, if the board can influence the larger entity, that's where we ought to go. It's a reasonable position for this community to take. It is absolutely a reasonable position. And I think that'll be acceptable. The more we promote that.
And as Valerie said, Lincoln County Healthcare is going to be coming out, I think, sooner rather than later with some public forums. And I certainly encourage each and every one of you and all your good friends to attend those so they can hear loud and clear what we've been hearing from us. Not from our voices, but from your voices. So So when they hold those, yes,
They're putting on a presentation for the residents of St. Andrews Village on Tuesday next.
well, let's have them have some nice visitors.
But Dan, don't you have to RSVP?
Yeah,
You have to RSVP.
Yeah.
It's not like it's a public invitation.
I would adjust your statement. I don't think they're public forums. I do think that they will be presentations.
They're just gonna do their own little spots here. Well,
Yeah.
we'll try to encourage them at our next meeting, just do something a little more
Revised
open.
PR campaign.
yeah.
So, Dan, let me ask you, how many of those things have you had at St. Andrews Village now?
Well,
Three, is this the third one?
we had
Four
a
in
meeting with Donovan and Monday.
Okay,
That was one meeting. We had another one with Forey and Fox.
Yeah,
That was the second meeting, and, you know,
and so what's this next one? Who's coming to this one?
with
Donovan, and I don't know who else.
And he's gonna tell us.
He's just gonna
what
pat
their
us on the
plans
head,
are.
and, you know.
Are those,
And we can ask questions.
Dan, are those meetings just for the cottages? or
For the,
Everybody.
for the, let's see, for the cottages
And.
and for the, independent living residents at the inn.
But I don't think they lock the door, and anybody doesn't know
I don't
that's
think
going
they would
to
either.
walk in there. and-
Well, there are other
Well, I know
residents who live
I
there.
know who was invited. I don't know
Aha.
I don't know what the exclusion may or may not be.
There are other residents who live there that should be represented perhaps even more strongly than the cottages and independent living. Because they don't have advocates, and to my knowledge, none of those residents or their advocates have ever been invited
To anything.
to
Well,
anything.
I
Oh,
think,
this is the people over the Gregory wing.
The invitation
Yeah.
is right there. You can read it, Rick. It's,
Yeah, so you have somebody in the Gregory
I would
wing.
like to invite you personally.
Thank you.
But you get the plane.
We'll be there.
It's on the 8th
Okay.
at St. Andrews Village.
At
At
10
10
a.m.
o'clock in the morning.
Actually, that's a very definite consideration. Who is attending on behalf of the people at St. David's, the dementia unit?
Yeah,
And the people in the Gregory wing?
that's right.
And
They're not
the people in
invited.
assisted living?
no, that's Rick's question.
Assisted
Yeah,
living.
that's the structure. Those are the people who are going to need hospital services the most, who are most likely to need them, I
Yeah,
should say.
there's another guy in 20 minutes. We're gonna keep our
And-
meetings.
Yes.
Okay, we've already discussed the Advantage study up under reports, so we'll move on to the next meeting.
Can I get one thing under old business?
Absolutely.
There's some discussion about establishing an independent website for the task force. We've had a donation of a domain name, paid and delivered to the task force already. So it's something that we could deliver, pretty inexpensively. You know, lots of discussion via email about how we should do it. So far, everything that we've done administratively for the task force has been in a parallel to the town of Booth Bay administration because it's easy for us to maintain if it's similar to what the town of Booth Bay does. If the task force is inclined, we could get a website up and running within a few days. It would be a great place to put our Ivantage study, and I could do it for a few $100s. I've got a great deal going on with a web designer that I know from previous jobs that has done the town of Booth Bay website, and I'm not sure if you guys have seen that. But I would like, if you guys are inclined to have an independent website, to have permission to expend some dollars to get that set up.
Peggy?
I would just like to say that this came up because we have a public relations person out of Denver who thought that we needed a website. And we were at the Booth Bay Register for some other issue. And our biggest concern is who is going to maintain a website and what other kinds of things can be on a website. And it's not just a place to plant documents that we want to get out there. There are other things to do. The Booth Bay Register has what they're calling mini sites, and we kind of had a walkthrough while we were there. Our PR person in Denver, well, I should back up and say, the Register's website is as easy to do as Facebook. And we all know how much Freddie Luke loves Facebook. And we all know how she wants to be involved with what's going on here. So we emailed Freddie and said, would you be interested in being a part of a conference call to walk through what the Register does? I think before we jump into any website, be it a standalone or joining up, so there ought to be a group of people who will say, I will maintain it, I will every day do this to it, I will X, Y, Z this. I mean, and see how easy it is to do it with a standalone, or if we go with something like the Booth Bay Register. And I point over to Mary because Mary was sitting in the Register as we got our initial walkthrough. I don't know what happened in the conference call. I don't know if you've ever talked to the Register, Jim, about how that system works. But there are, the major concern was if somebody is searching for St. Andrew's Hospital, would they have to go to the Booth Bay Register first? It is not our, that wasn't our understanding. It just so happens that the Register hosts this, and maybe Sue knows more about that. You know anything about that? It's a, anyway, I think that if whoever is going to work with the website needs to investigate it, and it's great for the town to pick up and want to do it for $300, but it's still a waste of money if somebody is not maintaining it and if we don't use it beyond just planting our documents there. Because we can do that otherwise. We can put that on your Facebook page or the whatever else we have.
Well, you can't attach documents to a Facebook page.
Or we can send them out to all of the list of people that we have. We've got all of the volunteers who that I understand are passing things on.
Yeah. The only decision that we made locally was not to make a decision, essentially, because first of all, we don't have our major document, our identity study, which is the one thing. It would be the centerpiece of anything as a web presence. So I don't think there's any reason to act quickly. But I did look at the cost of the Register's microsites, which is $500. I know that we could put together one for less than that.
But we still gotta ask who's gonna maintain it, who's gonna put stuff on there, what are you gonna put on there, and I think there's not a consensus of organization to be able to say that this is how it's going to, who's gonna feed each part that is available to us.
You just verbalized some of my concerns. I was gonna ask Jim, while it's great that we can get it for a couple $100 and it's a website, who's gonna do it? Because frankly, Jim, you got enough on your plate.
Well, that's why I wanted to line them up, because maintaining our website, our town website, is effortless because of the relationship we set up with the web designer that we started it with. It literally costs us next to nothing. It really is just mostly my time, which at this point we've streamlined, so it doesn't take as much effort. If I could maintain that that relationship with our web designer, I mean, maintaining it would be easy. It would be, I'm not sure, we would have to learn the process of the Register, which I'm sure is not entirely complicated. It's just a different process. And you know, the more different directions we get pulled in, I mean, the town is absorbing some of the nuances of the task force. We've kind of admitted, I mean, there's certainly mirrors to the fact that the St. Andrews Task Force meeting agenda looks almost exactly as the Town of Booth Bay agenda. It's because they're both on my computer and I just work on them both. So the more we can make those align, the less time it is for us internally. So that's why we entertained that idea.
So I guess the first question is, do we think having a website is a good idea?
Right.
You know,
I think having a website would be a good idea.
I do too.
I do too.
And we've had the domain donated to us, SaveStAndrews.com and .org were both reserved. So those are owned by the task force right now. We don't have to use those, but they.
But if we did, then they would line up pretty much with what you're doing now. Is that, as I understand it?
Well, when you get a domain, you're just asking for this,
Right.
you know, this spot in cyberspace. So we own that spot in
Right.
cyberspace. We can use that spot, or we can use any other spot that isn't already registered.
We might be able to set up some way on that we could accept PayPal donations too and that sort of thing.
Oh, that's really easy. And matter of fact, I know the web designer that I use a lot, has a lot of experience in that.
That's right.
So I guess my next question is,
That would be the advantage.
we are hearing that maybe we want to have a little time to discuss this before we make a final decision?
I don't think we need to, it's not one of those things you need to figure out tonight. But it's definitely a topic that got brought up during the
Well-
holiday break that we need to discuss.
I would say, I would feel more comfortable, you know, with all of the expenditures that we've been making, a group of people has come together, looked at the different paths and possibilities and given us a recommendation, and we've, you know, for the most part, gone with their recommendations based on their legwork. So I'd like to see that happen. I mean, that would be really helpful for me to make a decision on spending the money in the.
I
So
think we really need to look into the fundraising aspect of it.
I would move that we table the idea of creating a website until we can have further discussion.
Yeah, that sounds great.
All in favor? Is that what we're looking for? Right. Ah.
We did have one comment, question.
My question is, how are we going to drive people to the website? Which is why I thought the register site might work in our favor.
Yeah.
Because we would come up on their column. Plus, they're doing a lot of articles about it.
They certainly are.
People would be looking at it a lot.
Yeah, and even if we have an
The
independent
trouble with
site.
all websites is to get people to find them, right?
Right. I don't think any of your website questions change depending on who hosts it. I mean, if the Register does it, or we even toyed with the idea of it, if it's a page of the town of Booth Bay, which is, you know, has some cost savings in it, or if it's its own, you still have to come up with all the questions of how we structure it and how we artistically make it appealing, and then what do we put on it, and who makes those messages. And we're just lining up with the fact that we already know how to do that with one organization. And either way, you have some work to do, and we'll probably need volunteers to do them.
Okay.
Karen?
All right. Next meeting.
We have a question from the corner.
I just want to mention that the question of fundraising has come up a number of times. And as I understand it, any of the funds contributed to date, and still, to this cause, whether to either to the town of Booth Bay or to the Second Opinion Fund, are not tax deductible. In order for any deductions to be tax deductible, they have to be donated to a tax deductible organization, i.e. a charitable corporation. And there are several of us who have just decided that in the interest of making that happen, we'll create such a corporation. So more about that later, but I just want to announce that it's something that some of us think should happen.
So we're going to do it.
All right. Okay. We'll address that as we go along.
Next meeting.
I would like to recommend that while we needed to meet every week when this thing first started, that I think it's time for us to think about going every other week, so that we're not wearing these people out and wearing ourselves out, and that we can move through the process. And I think we ought to go with the first and third Tuesday of every month.
So you'll meet next Tuesday?
First and third. So this would be the first, because,
No, this is Wednesday.
well, we know,
Yes,
but
yesterday was the
All right, but is the Advantage report going to come out before next
we're
week?
not sure when it's gonna come out.
You know, I'm just gonna say that probably gonna take some time to get the work group to meet with Ralph and Scott. Since we haven't had that discussion yet, it'd probably take more than a week. Well, actually, a short week, a 6-day week.
Well, knowing that they have.
And I'm not suggesting that we slow down on our work
No.
load, I'm just suggesting that we slow down on our meeting load.
That's right.
Rather than first and third, perhaps alternate, because I believe there's 3 Tuesdays in
Well,
January.
so we may have a Tuesday where we could actually, that third Tuesday for me, I'll be in my budget meeting, whether you're here or not. Because my budget committee meetings are now finding up in Southport, so I recommend we do the first and third.
That's fine with me. Yeah.
And I know Stuart's all over that.
I agree too. I think that the number of meetings you have in between the official task force meetings don't need to diminish and the work doesn't need to diminish, but the reporting becomes more streamlined and we all get a little bit of extra time to actually do some work. I agree.
Move the vote.
Second.
All those in favor of going to the first and third Tuesdays of the month?
Aye.
So we're not here next
We
Tuesday,
will
Not
not
here
be
next
here next
Tuesday.
Tuesday.
even though it was in the newsletter that we were gonna
It
do.
was, well, we didn't know that.
No, okay, I'm
It will
just,
be, you'll get an
Another-
alert immediately,
All
no
right.
meeting next week.
So we will meet, the next will be what, the,
15.
right.
I'll entertain a motion to adjourn.
Oh, I so move.
Second.
All those in favor?
Yo.
Thank you all for coming out.
We'll see you on the 15th.